So welcome everyone to this evening's dental webinar brought to you by UFCW Local 1776 Health and Welfare Fund, featuring a dental consultant for the fund, Dr. Robert Slowick. But before we begin, I'd like to turn it over to Fund Chairman Wendell W. Young to walk us into the seminar.
Hey, welcome everybody. So Regina already did the intro on, we're here about the dental benefit. And this is really important because this past year we had some improvements to the benefit. And this is a good way to have a conversation with our members and shop stewards so that you know how you can get the best use out of your dental plan and get the best care for the benefit that you're covered with. And if used properly, help you also save some money in the process. So, Dr. Slawick's had a long history of being our consultant to the fund. We're glad he had the time to join us tonight. And we also have, obviously, Regina Reardon, our fund administrator, and Tim Wolf, who's going to walk through the presentation. If you can, you might hold questions to the end because they might get covered as we go through the presentation, save a little time. But we'll make sure at the end, if you have any questions, we take time to answer those. So with that, I'm going to turn it over, I think, Tim, to walk us through the slides. Thank you. Tim or Dr. Slowick?
Yeah, actually, let's just touch upon briefly. The topics we'll cover this evening include the importance of good dental health. And then we're going to focus on your benefits, your dental benefits through the fund, which are wonderful dental benefits, and spend a few moments talking about how best to limit your out-of-pocket costs for any necessary dental services you might need. So with that said, as Wendell mentioned, we're going to turn it over to Dr. Slowick.
Thank you. Tonight, I would like to cover the topic of periodontal disease and the medical implications of the disease. There are many ways periodontal disease can cause medical problems. It can enter the bloodstream, the lungs, it can weaken the immune system, and can be transmitted through saliva. Research has linked oral problems such as periodontal disease to many health conditions, including Alzheimer's, diabetes, poor lung health, lung disease, osteoporosis, premature childbirth, obesity, and stroke. The Journal of National Health Institute has determined that the body's immune response to the spread of bacteria during the later stages of periodontal disease can increase cancer risks by 14 to 20%. Some of the cancers are blood, kidney, lungs, pancreas, and tongue. You might think the mouth and the heart don't have much in common, but increasing evidence suggests that they may be closely linked. So you'll see your periodontist to ask about your heart health and your cardiologist to look at your teeth. Thank you.
All right, thank you, Dr. Slowick. Hello, everyone. My name is Tim Wolf again, and I'm going to go through some of what your dental benefit includes through the fund. So your dental benefit includes coverage for diagnostic care, such as x-rays, preventive care, like routine cleanings, restorative care, fillings, periodontics, such as gum treatments, endodontics, like root canals, and orthodontics, such as braces. And who is covered under the dental benefit is participants and eligible dependents. The calendar year maximum allowance for participating dentists and non-participating dentists for the current year 2021 is $1,750 per family member. And next year, effective January 1st, 2022, it will increase to $2,000 per family member. And just a reminder that payment for services provided by participating and non-participating providers are applied to the calendar year maximum allowance. And the maximum allowance does not apply to medically necessary dental services for children under 19. And just a reminder, if you're looking for the best benefits at the best value, make sure to enroll with a fund network dentist.
So as Tim mentioned, the best value is to enroll with a participating fund network dentist. So let's look at how those costs can differ, as well as what the various services are that are offered under the dental plan. So first and foremost, there's your kind of routine, normal dental office visit for an exam or cleaning. If you're using a fund network participating dentist, your cost would be $5. That's a $5 copay for cleaning and an exam. And you can have one of those appointments for a cleaning and exam once every 6 months. Now, if you're seeing a non-participating dentist, that is a dentist that is not in the fund's dental network, your cost will be based on a fee schedule. And the way that works is the fund has a fixed value for which it will reimburse the non-participating dentist, and then you can be balanced bill for the rest of the cost of the services if you're using a non-participating dentist. So the cost is usually much, 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 much more than the $5 copay for an in-network dentist. The plan also covers diagnostic, preventive, and basic restorative care. And again, you can have those services through a participating dental provider or a non-participating dental provider. The cost is covered at 100% for a lot of services if you're getting your services from a participating fund network provider. However, some services are based on the fee schedule, which basically means that the cost would vary depending on what the service is. But the fund always pays a huge amount more of the cost under the in-network participating dental fee schedule than it would on the non-participating dentist side. If you're seeing a non-participating dentist, again, there will be a fee schedule, but it's a different fee schedule than is used to reimburse claims for the in-network dentist. And your cost, once again, will be much, much higher under the non-participating dental fee schedule. Now, the plan also covers periodontics, endodontics, oral surgery, and orthodontia. Certain of these procedures are covered only through the medical benefit, and payments for orthodontia are not applied to the calendar year maximum allowance for dental benefits. Orthodontia actually has a separate lifetime maximum for benefits covered, and reimbursement for all of these services, whether you're seeing a participating dentist or a non-participating dentist, is based on the fee schedule. But once again, your out-of-pocket costs will be much, much lower if you obtain those services through a participating fund network dentist.
Thank you, Regina. Moving on, we'll talk a little bit about pediatric dentistry. So your child can be treated by a pediatric dentist provided the following. The child must be under the age of 4 or developmentally disabled. You must have a referral from your primary care dentist, and you must obtain a pre-authorization from the fund's dental consultant, which is Dr. Robert Slowick. And for anesthesia, the plan offers coverage for procedures involving extraction of 5 teeth or more. And when using an out-of-network provider, benefits are based on a fee schedule, as Regina explained. Your cost will always be higher with an out-of-network provider, so make sure to choose an in-network dentist. So just contact the fund office for a list of in-network providers. You can call 610-941-9400, extension 128, or you can visit the fund's website at https://bit.ly/UFCW dental providers. So if you want to enroll in an in-network fund dentist, there's 3 simple steps. First, request a dental enrollment form. Complete the form with your selection of a dentist from the fund's dental network, and submit the completed form to the fund office via mail, email, or fax. You can send the completed form to the fund office at 3031 Building B, Walton Road, Plymouth Meeting, PA, 19462. Or email Beth Taylor at the fund office at btaylor, BTAYLOR, at healthcarestrategiesinc.org, or send it via fax to 610-941-9602. And please note, if you do not return a dental enrollment form to the fund office, you will automatically be enrolled in the out-of-network dental benefit, which will result again in higher out-of-pocket costs. And if you enroll with a network dentist, your entire family must use that dentist. And you can select a new fund network dentist once every 12 months. So with that, we'll ask for any questions.
Tim, there is a question in the chat. I don't know if Regina,
Oh,
you've had a chance to read it yet.
I have not.
So I'll read it. Are the in-network providers changing with the coverage change? The selection of the network providers aren't so good. It's been a trying time with the dental office I'm assigned to right now, constantly a revolving door with dentists and hygienists. I would love to use the maximum benefit of my insurance and save on out-of-pocket cost, yet it's impossible to do what's being promoted here with the dental provider selections.
So I'm sorry to hear that participant is having difficulty. So we're always looking to expand the dental network. And right now we are embarking on, and it happens two ways. Sometimes we will, a dentist will contact us at the fund office, or they'll contact Dr. Slowick seeking to join the fund's dental network. And that happens periodically, but we're in recognition of the fact that we would like to improve the dental network and provide additional dentists. We are about to embark on a solicitation to, pretty much every dentist in our service area who is licensed to practice or a member of the American Dental Association to kind of try and entice them to join the panel, because we do recognize more dentists are better for our participants. So so we hope to improve the number of dentists, bottom line. I think some of the difficulty of late is related to the pandemic and the impact it's had on employment at the dental office, as in almost every business. That doesn't make it any easier, but hopefully it's a passing event and we'll get through this. But if you are really experiencing a lot of difficulty with your assigned network dentist, I would urge you to call the fund office and let us know who you're seeing, and if we can perhaps help you to get with a dentist where maybe they have more availability or less turnover in the fund in their dental office, we would be happy to do that. And as Tim mentioned, the rule is you can only change once every 12 months, but under exceptional circumstances, if you really can't get an appointment and you need services, we will help you get the transition to a new dentist that can solve your dental needs. So
Regina, there's a second part to that says also a lot of providers in my area are listed but aren't accepting new patients. Therefore, we are forced to go out and network. Clearly, we have work to do in this area, and part of that work is maybe more frequent updating of the provider listings and maybe a more of a concierge approach from the fund office at helping people get service, whether it's an in or out of network dentist, if there's not a network one available.
Good, absolutely, absolutely. Please call us, and we'll do whatever we can to help you get with a dentist that can help you meet your needs.
Okay, are there any other questions?
There are. We have another question about fund coverage. This person's asking, does the fund cover dental implants?
And Robert, do you want to take that one?
Yes, we have just recently added dental implants to our services. So they're a case-by-case basis, and then will be approved by me as they come through on a claim.
Well, the next time I get punched on a picket line, I'll be coming for my new implants.
Absolutely, Wendell.
All right. We'll do a few more questions. This one is asking, what is a good electric toothbrush?
I recommend the Sonicare toothbrush along with the Teledyne Waterpick to all my patients, and I've seen great improvements just in the oral health that I've seen with my patients over a 6-month recall.
I just want to say, while it's been a while, my favorite was the Winnie the Pooh one.
And we also have a similar question leading on off of that. What about interdental aids?
Again, any of the dental floss helps a lot, and also the gum proxy brushes. We again recommend, my hygienist recommends, and also something called a Stimident. You can find both of those at any of the CVS, ShopRite, or Acme's.
And Rite Aids.
Yes, Rite Aid.
Is there any other questions, Tim?
That was the last one.
All right.
And just real quick, Wendell, just a reminder that this recording of this webinar will be posted to the fund office's YouTube page. You can find that by going to https://bit.ly/fund office YouTube, or by searching fund office YouTube.
Great. So the Tigger is going to be upset that I favored Winnie the Pooh. Tigger's a lot more aggressive. So anyway, listen, we don't have any more questions. Robert, do you have anything else you want to add that you think would be helpful for folks?
I'm pretty good, Wendell. Thank you.
All right, Regina or Tim?
Oh, thank you for joining.
All right, having no more questions, covered the agenda, very succinctly. I want to thank everybody for your time. And as was already mentioned, please contact the fund office to help you navigate some of those challenges in selecting or changing providers, especially if it's something that you need done. It's you're in pain or it's an emergency. Thank you, everybody. Be safe.